So welcome to Trends and Suggestions. Those who are watching live, I have a very honorable guest today, whose name is Dr. Prashant Chandra, who is a surgical oncologist. And I am blessed to have him on the board. And I want to learn many things from him. And those who are watching live can learn many things. Before I give it to him, I just want to share about him a little bit introduction. He is an assistant professor and surgical oncologist, and as well as he's an author as well. He has wrote this book called Chandra's Concise Textbooks of Surgical Oncologist. I would, before I go further, I want to know from you, Dr. Prashant, about what exactly the book is about and what is your purpose and mission to come in this profession. Over to you, Dr. Prashant.
Ma'am, first of all, thanks a lot for inviting me for this program. Ma'am, I have written this book because I did DRNB in surgical oncology, and I know the pain of giving this exam. I mean, in this exam, the students, when they go for their exam, they go to an unknown institute, unknown four people are examining them. I know they are going to be surgical oncologists, they have to prepare very good. But on a counterpart, when people are giving MCH exams, which are considered equivalent or even superior to a degree, they give a very easy exam. So I wrote this books basically for DRNB surgical oncology students. They can read this book, they can understand about the concept of surgical oncology and pass their exam. Apart from that, this book is also meant for common people, other doctors. They can read and know about oncology. This book is not about surgery. I have not written anything about surgery. I have written only about cancer, their symptoms, their genetics, their biology. So this book is basically dealing with the biology of cancer, oncology, the epidemiology of cancer. So it's mainly for doctors, but even common man can read and understand about cancer.
Thank you so much. It's really an honor to know about more about this, because in the description box, I would request you to give me the link of that book so that I can mention there, and people who
Surely.
want to know about this can go and just directly read about that.
Surely, ma'am.
So
Actually, I have
now
got a
my
peep
question
in
to
the book,
you: what
PDF
proactive
available.
steps can employees, because we are focusing on this cancer awareness in corporates. So
Yes.
as we know, in corporates, a lot of work pressures are there. So in this case, some questions comes: what proactive steps can employees take to reduce their risk of cancer in the workplace?
Before I answer this, ma'am, I would like everyone to understand that what are the risks for getting cancer. The most common risk factors are tobacco abuse, over abuse of alcohol, sedentary lifestyle, obesity, too much consumption of sugar. So basically, we have to cut these risk factors. You know, in corporate, we are under a lot of stress. We are working under stress. Just get relieve our stress. We go out, smoke a cigarette, and come back. This is actually killing us. This is not killing us stress. This is killing ourselves. So we have to abstain from tobacco. No amount of tobacco is actually advisable to take because any amount of tobacco can cause cancer. Alcohol should be in moderation. Okay, we are celebrating. I mean, in corporates, usually we celebrate as well as whenever we get some sad news, also, we just wash our sorrows with alcohol. But thing is that alcohol out of moderation will lead to many cancers, starting from breast cancer, esophageal cancer, pancreatic cancer. There are many cancers that are attributable to high alcohol abuse. Apart from that, sedentary lifestyle. I mean, whenever we are doing desk work, we are just sitting prolonged on computers. We have to take break from that. We have to walk. We have to do some exercise. Routinely go to gym. We have to cut down our sugars. I know when we eat sugar, we get a kick. Our brain start working a lot. We can come up with many ideas when we eat a lot of sugar. But sugars actually lead to pancreatic cancer, kidney cancer, breast cancer, because they increase our weight, and obesity indirectly is a risk factor for these cancers, as well as esophageal cancer.
Yeah. Thank you so much. Yes, because this is very important to know, because we all now corporate workers are also working as remote. They are sitting at home continuously. doing the work at home and watching the laptop and all the electronic gadgets. This is also they are not taking care of their health. They are just always taking care of how to satisfy the company, because companies have already put a deadline that you have to submit your work during this time, otherwise the salary gets deducted. That also can be understood, but please take a
And
break. And
especially
then
when,
always,
working from home,
yeah,
while working from home, people have access to their kitchen. People are just
yeah,
eating like anything. And obesity
yeah.
is a risk factor for several cancers. So as you
Hmm.
correctly said, ma'am, work from home is another, risk factor for cancers.
Exactly. So since I'm also working from home, so and even the automation has come, no, we are automatize all the work, and then half of the work is automatized and half of the work we have to do. But when I'm doing it, I'm also thinking, okay, I'll skip my lunch, I'll skip this, but it is also dangerous. If you're skipping your breakfast or skipping your lunch, how it is affecting the health. So since you are here as a doctor, you can say, is it, huh?
Yeah,
Yeah.
ma'am, absolutely. See, a healthy lunch, which is balanced diet, we skip our lunch and then we go for coffee, which is full of sugar. We take a biscuit or we take some sugary thing with it. We say that we skipped our lunch. It's okay to, we can compensate those calories. But this is predisposing us to obesity. We think that obesity is only a risk factor for heart diseases. No, it's a risk factor for cancer, breast cancer, kidney cancer, esophageal cancer, pancreatic cancer. These all are related to obesity. So skipping lunch and just compensating it with some sugary intake is actually not justified.
Uh-huh. But my question is, another thing,
Yes.
people generally skip their lunch and have only a put of nuts. Is it fine for them to have it? Because they are just taking the nuts. As you know, there are seeds, pumpkin seeds and all those stuff are available in the market right now, because the work pressure is so much that they don't have the time to cook for themselves. They're just finding some ready-made things to just to have it, a munch of it. And then is this sufficient for lunch, or what is your advice for this thing,
Yeah,
for the
ma'am,
lunch,
as I
breakfast?
emphasized, balanced diet is very important. See, I'll say one thing. As you brought about the nuts. Nuts are actually healthy. Ground nuts, they are actually healthy, but there is a fungus growing on the ground nuts, aspergillus, which is a known risk factor for esophageal cancer. Esophageal cancer is disease of China just because their grains are contaminated with this fungus. So, take care. We don't know that fungus might be growing on those nuts. These are packed nuts kept for, I think, 6 months or something like that. So,
Yes.
importance of balanced diet can never be. We cannot ignore the importance of balanced diet.
Yes. Now the question comes, since when the doctor is near, definitely so many questions will come up. How can corporate wellness programs be tailored to include comprehensive cancer awareness and preventive strategies?
Yeah, ma'am. Actually, I appreciate corporate culture for this. That always some health programs are going on there. Some seminars are going on. Some doctors are coming. They are telling about various diseases, be it kidney stones, or be it about cardiovascular diseases. But somewhere I feel cancer awareness is lacking. First of all, people need to know that why the cancers, what causes the cancer: tobacco, alcohol, sedentary lifestyle. Then there are several risk factors for different cancers, but people are not aware of it. Even I'll say doctors are not aware of it, and that's why in when a normal doctor is taking such seminars, they are not able to tell about it. Second thing, symptoms of the cancer. I know we are going to discuss about all these things in this program. So people should know when to go to an oncologist, what symptoms they should keep in their mind and go to oncologist. So the importance of screening for the cancer. So such things should be emphasized in the seminars that are going on in the corporate system for their healthcare. So these things should be incorporated in your health programs.
Yeah. And self-examine that yesterday, one of Dr. Richard Saxena also spoke about this. What exactly happened? Female are not taking care of health, right? Not only the female, male also doesn't have the time to take care of, because those who are working continuously,
I
they
agree.
can take care of the health by self-examining. So, what are the techniques of because sometimes people are, if they can do the self analysis, and then what are the symptoms actually when you just spoke about, for in example, in my father's case, my father, when he developed cancer, we found his foot was getting means it was like swollen. Okay, and then we decided to take him to the doctor, and then they advised for the oncologist. So then this comes. So any other symptoms which you can at least highlight, so that the people who are watching this now and later will get some ideas about it? Yeah, over to you,
Yeah,
dear.
ma'am, regarding symptoms of cancer, uh, see, first of all, cancer, these are the painless things. In the beginning, they are painless. So there might be a ulcer or a wound in mouth, and it will be painless. The patient will never, I mean, the person will not go to the doctor. He'll say it's a painless thing, it will just subside. But any ulcer not healing, any oral ulcer not healing within 3 months, so this may be cancer. Should you, one should consult their oncologist. Then bleeding from anywhere. I mean, a lady who has completed her periods and now she's getting some bleed, this may be a symptom of uterine cancer, or a lady who is getting bleeding in between her periods, bleeding from anal canal, or even bleeding mixed with the stools, bleeding in vomitus, bleeding in sputum. These things could be a symptom of cancer. I'm not saying that bleeding is necessarily cancer, but bleeding is one of the symptom of cancer. So anyone who is getting such bleed should get themselves evaluated. If they get evaluated, the cancer is ruled out, well and good. And then any lumps, lump in breast, lump in neck, lump in armpit, lump in groin region, they may be symptom of cancer. So such things should be evaluated by an oncologist. And I just want to emphasize to them, I mean to everyone, that sometimes we go to a doctor, the doctor examines us. These are the general physician. They may miss the cancer. They will just say, doesn't look like cancer. You don't have any pain, it doesn't hurt. It is not cancer. Let me be very clear about it. Cancer can be ruled out only after a tissue diagnosis. The doctor should be taking a tissue bit, should be examining it under microscope. There are few cancers we don't do this, like pancreatic and because spillage can occur. Otherwise, all other cancers, a tissue bit should be removed. It should be examined under microscope, and cancer should be ruled out by microscopic examination. So just keep in your mind, if your doctor is just touching you and saying it is not cancer, it's a bit suspicious. Go to an oncologist, no problem. Oncologist is not going to diagnose cancer. He's going to rule out cancer. You don't have cancer, he'll tell you you don't have cancer.
Absolutely with you in this case, because my father, when diagnosed with cancer, we have shifted him to Raheja, and the oncologists are very, because see, the thing is, oncologists, whenever we heard about psychiatrists, oncologists, people get scared in the previous
Agree.
so yeah, so if we have a belief that I want to live for a long, or if you want to have cancer, is not a big disease, it can be now curable. If it you see in the backs in the now artificial intelligence have come, so how artificial intelligence can help in diagnosing of the cancer, and how it is helping the
Uh,
doctors in this case?
yes, ma'am. Ma'am, actually, see, artificial intelligence is basically a smart replacement of human being. So till now, artificial intelligence has not penetrated too much into oncology, but I'm seeing a lot of, a lot of future from artificial intelligence. See, thing is that in today's era, we do a scan, we do, take a microscopic picture, and human analyze these things. In future, artificial intelligence or computer program will analyze a scan or a microscopic picture, or even say a patient is coming with some clinical feature, complex clinical feature, complex clinical history. A computer program will analyze it. He will calculate the risk factor, how much risk factor this patient is having for getting a cancer, and he will actually, give a probability that this is the probability that you have a cancer. You get evaluated by an oncologist. So actually, I'm looking forward for the artificial intelligence to come up deep into the oncology and help the oncologist.
My point was like that only, because it cannot be replace a human, because it cannot do the surgery
Actually, it
itself.
cannot.
A robot
It
cannot do
cannot.
a surgery of a human being, right? So you
Yes, ma'am.
the pain and oncologist, while just doing the operation, can understand, because psychologically, when you are giving us that balance, right, the support, right, what exactly, when we are visiting to any
Yes,
psychologist, that
but
artificial intelligence will not understand our emotions, right? They will give the answers which is very much like machines. Sometimes we human becomes like machine when we start, okay, we have so many work to do, right? The stress comes. So how I want to just to take only 2-3 minutes of yours, because I know from one surgery to you have to again go for the surgery, and in this time you have given us the valuable time that is important. Means that is my blessing that I am getting you, and I'm just first let me go to the question: what role does a regular screening play in early cancer detection, and how can employees encourage their workforce to participate in such screening? Because many people gets, whenever they are heard about the medical, they don't come to the office screening, and even for the eye checkup also they don't come for the office, they skip.
I
So
agree.
in
People
this
are
case, how
scared.
to help the
But
employees?
yeah, let me be very clear about this, that cancer can be completely cured if it is detected in early stages. And screening is basically normal individual who don't have any symptoms. They are being checked, and we are trying to detect cancer at very early stage in these people. See, screening is not applicable in all cancers, but in many cancers they are applicable, like oral cancer, breast cancer, cervical cancer, and in high risk individuals, even lung cancers are screened nowadays. So screening can just detect the disease where it can be completely cured. And we should actually encourage people to come for screening, especially in breast cancer. It has reduced mortality. I mean, research has been done, and 10-year mortality, it was found that just by screening by mammography, breast cancer mortality has decreased. Death due to breast cancer has decreased. Similarly, cervical cancer in our India, it's a killer disease. I mean, people come with advanced stages of cervical cancer. Just by simply doing a pap smear, we can diagnose cervical cancer. Not diagnose, but we can detect that this patient is at risk of getting cervical cancer. In such patient, we can operate her very early before the complications arises, and she'll be cured. She won't die of cancer.
Yeah, that's true. Because the what exactly the values I'm getting from your was, because it is giving me a greater insight, because people generally don't. In the case, this is something was come up in the episode number 1 with Swanlata. Her mother was suffered from blood cancer. People are unable to give blood. As an oncologist, please help the people to understand: is it important? Is it like this, that is, if I'm giving blood to any cancer patient, that is, I will develop blood cancer?
Yeah, ma'am, this is actually a very important thing. People take cancer as a infectious thing. I mean, people need to understand that cancer is not infectious. Just by sitting, even if we sit and eat with a HIV positive patient, we don't get HIV. Then cancer, it's remote that we will get cancer just by sitting or in coming by coming in contact with someone. I'll just tell you a small thing. My neighbor, she's getting treated for cancer by me only. So I asked my son not to go near her. So she felt bad that why I'm asking my son not to go near. That reason was she was receiving chemo. We have to isolate patients sometime because they may catch infection from other. But no one can get cancer by just going near a cancer patient. So I told my son, I'm asking you not to go to her because you are having running nose. You will infect her, but she cannot infect. So cancer patients are not infectious. They are not stigma. They should not be isolated. They need to be isolated only during chemotherapy because they can contract infection. Their immunity is down during that period. By giving blood to a blood cancer patient, or by coming in close contact, by serving a cancer patient, we cannot contract cancer. Impossible. Biologically, scientifically, it is impossible.
So people doesn't want to give the blood because they feel like this. But thank you for bringing this words, because for giving the advice, because many people can save their life if we are giving the blood from our body to the other body, those who really in need during this time. And we are launching this on 13th of August, where we are talking about we are here to hear. Here, I will request you to be the part of it, because
Sure.
doctors are required. It is only for those employees, for everybody we are opening, because this is a noble work which we always feel like that, serving people. We are in the earth to serve you all. Where you have your problem, come and talk to the community of all the panel people who are supporting you in that panel. And 14th of August, I would request each one of you to just to join the session to see what 14th of August at I am just planning. It is on the planning stage. The timing are not been fixed, So when the timing will get fixed, will be announced, where all the speakers whom you met till sixth episode, even Dr. Uh, Prashant is also here. So you can see everybody will be there supporting you to say about how this we are here to hear will do. This we are here definitely to hear your problem, to solve your problem, and to give you the better future so that you can give the best to your quality time, spend your quality time with your family, with a freedom mindset. That is, we are there to make you aware from the beginning. Stop cancer, right? And the thing is, if you are stressless, you will get no cancer, nothing. And that's the reason. And cancer is not a big disease, because my father is also diagnosed with cancer, and I have already took the interview of Meenakshi Mehta, who was diagnosed with breast cancer, but everybody is now all well. Okay, they are doing a well working. They are all well in their because of the oncologists, the way they are doing the best job to the world. So this is what the small, I will be definitely bringing them on a screen on 14th of all the people who have been interviewed till now. And since I know your timing and you have given a valuable time, Dr. Prashant, you're being into this profession, and you are just coming right now after doing one surgery and then coming here. And one question to you: how do you manage your health? Because being an oncologist, how do you take care of your health? Because this is helpful to the other doctors who are going to become a doctor. They should also take care health, and then they think for the others, right? So how do you do that?
Actually, this is a big question, man, because when I was small kid, I was told a joke that there was a very thin guy in a village. So people said that this village is very healthy. People are very healthy here. Then they said, "Who is this thin guy?" They said, "He is the village doctor." So usually, doctor they distribute their health among their patients. So actually, ma'am, being a surgeon, it become very hectic for me. Sometimes I'm operating late in the night. I may miss my dinner. I may miss my lunch. But then I make it routine that if I miss my lunch, I'll eat some balanced diet. I won't just eat some nuts or something or some carbohydrate rich food. I mean, I have to take care of my weight. I make sure that I go to gym twice or thrice in a week, keep my weight under control. Then uh, alcohol should be in moderation. Actually, I'm a teetotaler. I don't take alcohol, but those who are taking alcohol, it should be in moderation. Avoid tobacco abuse because surgeons they are very very prone to tobacco abuse. We have to do a complicated surgery. We just try to vent off our stress. People go and smoke. Tobacco has to be, I mean, avoided. Zero tobacco. There is no tolerance for tobacco in oncology. So these are the measures that I'm using. I'm not perfect. I mean, even though I'm trying all these things, but sometimes I just get towards the sweet food, carbohydrate rich food. I slip down and I eat them. But we have to take care of our health. Even if we are operating late in night, we should get 6 hours sleep minimum in a day.
That's important. 6 hours sleep
Yeah,
is very important. 6 to 7
very
hours sleep,
important.
which I am skipping for 2 hours because I am doing so many work. I can understand while writing and publishing and everything because it needs time, right? And apart from it, taking sessions, everything, because we are all into this profession because you are a doctor and we are being into hypnotists. We are also giving a bit of hypnotism to stay calm, to keep stressless. This, as you are
Sure.
working for 24 into 7, but we are giving our time because we are not able to work for 24 into 7 like this. This it is also we are searching for our me time. And how to, as a doctor, how do you manage to get a me time? Because it's a very big question for the doctors because you are into completely dedicated to the world, right? Yeah.
Yeah, that's another important thing. Actually, I mean, what I have learned from my own experience, I mean, I've kept a fixed time for my family. This much time I have to give to my family. Even if this leads to a compromise in my other works. Suppose I decided that today I have to write 2 pages for my book or some article, some research article. I won't write that article today. But I have to look that I'm dedicating my time to my wife, who herself is an oncologist, to my son. I have to teach my son, I have to play with my son, I have to take my son to roam somewhere out. So that time should be fixed. That time should never be compromised. You can compromise on your writing work. I mean, it's not a good idea, but sometimes we have to compromise on a writing work. Sometimes I have to cancel some appointments if they are not very important. This is just a follow-up patient. Patient can come tomorrow also. I'll just request them, please come tomorrow. Today I cannot meet you. But never compromise on the family time, because once my son will grow, he'll become adult, he won't become child again. So this is my personal experience, my personal what I feel.
Very beautifully said, because parents sometimes doesn't able to give that time to their children because of the work. In my case, my father was completely dedicated to work, that he always avoided me and my brother, means both the siblings grow. The fact is, my father was like, couldn't give the time because he was too much dedicated. He was working in Calcutta telephones that time, and now it is called BSN. So we can understand that how much important the childhood will not return back. Uh, this is the reason now we are giving time to my niece, and to my brother is giving time to her daughter. So it's very essential thing. And yes, and what I would suggest, I would request you to just to come on 14th and to share your knowledge again with the people that we are launching on that day. We are here to hear. I would request you to be here with the other team members of our community of We Are Here to Hear. Today morning you have saw some people over there, but I'm introducing you, and would love to I would love to have you on this We Are Here to Hear in that platform,
Absolutely.
uh,
Sure.
where it is for the people who really need, and they can come, they can join the WhatsApp group and put their queries, where whatever way we can help them, we can do it. And definitely, I will be sharing all the details of Dr. Prashant in the description box, how to connect with him, what is this book all about, all the links I will be sharing over there. And please connect with him, because he's I don't I avoid doctors in life, okay, but I never saw you as a doctor. Because I was just talking to you, I am not too much open with any doctors. Whenever I'll visit any doctor, I
Thank
used
you.
to say bye bye to you, because I know how to manage myself. And now I'm just talking to this doctor. Like, I never think that he is a doctor. The way you are talking is not a doctor terminology, right?
Thank you, ma'am.
I'm thinking that I'm talking with a friend. Like this way, I'm just feeling, my feelings was like this. And I love this type of doctors. So oncologists are really a friendly, because I met two oncologists till now, you and my father, the under whom, and I don't feel like they're doctors. I think like they are like friends. Now also I'm feeling like you as my friend. I know you for a long time. I'm talking to you, but I avoid doctors. But I personally took the interview to understand how the oncologists are, and specifically when I meet them, I never feel like meeting any doctors. Oncologists are like that. So don't get scared. You can see Dr. Prashant in front of you. He's like a very friendly person. Because right now I met him. Oh, this via this interview only, and I never feel like that I'm talking to any doctor. The way you are interacting like a normal people, with the normal terms. So connect with us, stay connected, and the takeaways from you are the company should arrange medical seminars to highlight what are the causes of why it is happening, cancer specifically, and which many of the doctors and many of the people are talking about the seminars, but he specifically talk about what exactly to be discussed in the seminar. There's what are the cause, how to get diagnosed from the beginning, so that, and the screening, the way he has helped us, Dr. Prashant, is like, don't skip the screening now onwards, please come and attend the screening. Nothing will happen when Dr. Prashant, when the other doctors are available like this, the oncologists are there. And over here I'm just talking about Dr. Prashant, because Dr. Prashant will be a part of We Are Here to Hear. and it is like you can directly ask them questions. It is a noble work where you are not charged. You can just ask the question, and even if you are if you are suffering from cancer or anything, you can directly go to their medical, or you can directly connect with them separately, then to get the guidance, right? That is different, but in this whatever we are launching is free. Yeah. So just that, like that, the where we are just, you can put your questions. Nothing over there. That is put your questions, put your pain. That is what the main thing is all about. And the rest is the guidance will be provided with the, as per the doctor's guidance, when doctor will have to visit to the chambers. So please connect and join and let us know how much you want to do this. So thank you, Dr. Prashant, for your valuable time and valuable inputs.
Thank you, ma'am.
And definitely we are looking forward to put you into this project, and we will work all together. And as mentioned, in the group, it is free, but when they are personally visiting you, that is your charge. Right? So yeah. So
Actually,
this
ma'am,
is
I am
this.
part of DY Patil Institute. So there, I mean, if someone wants to visit me, it's just 20 rupees fees.
Yeah. Okay.
Yeah.
That's the magic. This is called the doctor. They are God, really God.
And
So
I just want to emphasize, anyone walking to me, you don't have cancer, we won't diagnose cancer in you. We will rule out cancer in you. We will tell
yeah,
you don't have cancer. So
yeah,
don't be scared coming to us. As ma'am
yes.
rightly said, that we are normal people, just like everyone.
Right, exactly. Because ma'am herself gets scared of doctors. Don't go to the doctor. So, but the thing is, if I get this type of friendly doctors, I will definitely visit, because I thought of visiting to the oncologist, because oncologist is not required for me at this point. Because I love that oncologist, my father, who have diagnosed my father. He is so beautifully. He was connected with me. He was appreciating my work, and even you are the person who have come. I feel more comfortable with the oncologist than rather than the direct physicians who are means this MDs and everybody,
Yeah.
MBBS are, you are also this, sorry, but the oncologists are special, because I think they are real God. Please come and visit them. Do not get scared about that. So fine.
Thank
So
you.
we'll connect. We'll come on 14th with the bang on this. We want to say show, means what to say. We are going to launch it, and as being in, when once we are launching it, we will be having a definite time and everything. We will be talking about that app, not app, about this WhatsApp group, when to you can connect with them, and because they will also tell their schedules when they can give. Because if you are pestering them, give the answers. It is not possible. For example, Dr. Prashant, who is a surgeon, Rahul, George, who is the India's premier hypnotherapist, he is also not available every time. So, like people, those they are coming. Even Dr. Richa Saxena, who is a gynecologist, if you're continuously pestering them to give the answers, they can't be give you answer 24/7. So we will be scheduling that time. Everything will be coming on 14th. I will be discussing in depth how to connect with them, what time will they be able to give your answers. And then if it is required, I will suggest you to request you to just to visit to them, direct, go and meet them in their or you can
Clinic
have
or
one to
OPD.
one if you are from the other India part of India. If you cannot directly go to the clinic, please connect with them one to one. And because in case of cancer, people are not open to discuss openly, so one to one connection will be important, and all the details will be provided. All the help will be given there. So come, and nothing else. And it's that magic. 20 rupees में तो बड़ा पाव भी अभी बंद हो गया है मिलना, and
But okay.
doctors are available. So it's
And just
good
to ma'am
that
add
they
to
are
it,
doing
I
this
mean,
noble
we are
work.
treating
Please,
all
please,
cancers
yeah.
under government
Thank you
yojanas
very
here.
much. Huh?
I was saying that to add to it, we are treating all cancers under government yojana. So patients are getting treatment free of cost at my
Yeah.
institute. Cancer treatment
Yeah.
is completely free.
See, now what to say?
So only thing
Yeah.
is that someone has to walk to us. We will
Yes.
treat, we will cure.
Yeah. So definitely this is happening, and yes, so please come connect with them. The details will be there in the description box, and we'll definitely connect with and 14th we are coming with the or full details, and we'll meet again. And till now, so thank you so much, and bye for
Thank you,
today.
ma'am.
And we'll meet again with this doctor. I love this doctor's smile. I love the doctors, the friendly nature, and I
Thank you,
love
ma'am.
this oncologist. The way the oncologist department I love now. The oncologists are really a god. Okay, 20 to free they have put it. Nothing else. Come, come and check it out, because your body is ultimately your health is your wealth. The ultimate thing which I
Agree.
understood is that. So if you are not giving proper assets is your body. You're not taking care of your body, you cannot succeed. So take care of your body first, and then take care of the others. As we all know, when we are taking a flight, it is said that first use your mask and then help others. So you first take care of your body and then help others. So please come, and and please connect with them with him for the father diagnosed. And he is the way he is talking, I don't think I'm talking with a doctor. Honestly speaking, this is an honest feedback to you. I am not feeling like I'm talking to any doctor, and it is like I'm talking to a friend with whom I can easily get diagnosed, if because this is what I am personally feeling talking to the oncologist. So
Thank you, ma'am.
connect, and if you want to share anything to the other things to the viewers, please feel free to connect, and then we will be closing this conversation.
And I'm being an oncologist. I mean, in the beginning only you asked me why I choose to become an oncologist. There have been many cancer cases even at my family. I have seen death due to cancer. And I always felt that somewhere it's not the disease who is killing us, it's our ignorance which is killing us. So I'm myself an oncologist, my wife is also an oncologist, and we are just working for cancer. I mean, both of us are treating cancer patients free of cost under government yojanas or government schemes. And even if I talk to, I mean, some of my friends, I'll just tell them that don't smoke, don't use tobacco. One day you will come to me, and and that day you will be crying, and I'll be just trying to console you. Let's not let that happen only. So the reason I became an oncologist is just to make this world, I cannot make world free of cancer, but I want to reduce the pain of cancer. Let no, cancer patient cry. My heart beats for all cancer patients. And I just want that let the cancer be there, but we won't be scared of it.
Very nice this way. And okay, there is one important thing which you have pointed out about the smoking. We cannot coax people to stop smoking. That is the reason Rahul George, who is India's premier eye hypnosis coach, okay, who is going to speak about this. A very important point, because he is working with the quit smoking. Here, NLP and hypnosis, he is the expert in this, okay, and we learned from Dr. Banda one thing, that we cannot the person who wants to stop smoking, we cannot ask them to stop smoking until and unless they are making from their mindset that I want to quit smoking. In my father's case, my father was a chain smoker till he is now 72 years. Before, when he was diagnosed cancer, still now because his reoccur of cancer happened because his lifestyle was not correct. So in 2020, he was 2022 or 2022, he was diagnosed with gallbladder cancer. So what exactly happened is that he didn't quit his smoking. He was continuously, he's a chain smoker. What smoking is, until and unless the person, okay, he helped him, is my mentor, helped me to, there are certain techniques which we do, techniques. We will be helping the patient, not the patient who is a chain smoker. We will give them certain tools and techniques with their hands, no, nothing with, and making their brain mindset in such a way that they can say themselves, if once they are ready, I want to quit. I'm done with the cigarettes. Just help me to quit. Then we can help them. Until and unless if we are asking our chain smoker to stop the stop, please stop, please stop, they will not do it because they will say, they will think, what will happen to me? Okay, cancer, it's fine, I'll go for the chemotherapy. This is what my father's attitude was. So say this, but suddenly when he got the pain of chemotherapy and radiation, that time only he's thought of, I know I need the guidance now to stop cancer, stop smoking. So don't wait till that time. If your mindset, make your mindset, that is your fault. We are not coaxing. This is your mindset. If you say, yes, I want to quit smoking, here we have Rahul George in our community over there who can help you, who can guide you the way he guided my father. He can guide you also how to quit smoking. And the in his case, he's not coaxing. It's something like, if you are ready, if your mindset is, I don't want cancer in my life, chemotherapy is very painful. So, and yes, as he spoke about chemotherapy and radiation, both are very, very painful. And he doesn't want to listen to that cry. Actually, go to the any cancer hospital, sit over there, see a child is also crying with this chemotherapy. If you want this pain, so it's your choice. If you want your child to be healthy, and if you want yourself to be healthy, please, that is your choice. If you want to quit this smoking, this habit of alcohol, that is your choice. So thank you so much. And thank you, Dr. Prashant, for your valuable time. And many times I will tell you about this quit smoking, you have got it. And this gives me the greater insight to talk more about it. So thank you so much, because you will be a great help for those people who are the oncologists specifically who are smoking. Okay, if they smoke, then the patient will say, "Are you are smoking? No, you. How can you be my idol?" Right. So definitely bring those oncologists first to quit the smoking. So here, I'll definitely introduce you with Rahul George. He will give greater insight on 14th about this quit smoking. Because he is always teaching me one thing, that is, when the mindset is ready, then only help. If we are coaxing the person from the beginning, they will not leave. And that is what it is a tested one. So thank you once again. We'll again meet on 14th, and I love the way you have given the values. And people, please share your learnings, whatever you have learned from Dr. Prashant, please put it there. So thank you once again. We'll meet, and I'll share all the details of Dr. Prashant in the description box. Please connect with him. And nice to hear that your wife is also in the same if you possible 14th, if she is free, you can bring her also in the same platform. Yeah. Thank you so much. Yeah.
Thank you.